Tonight on Q2, behind bars.
Marshal Service was offering $115 a day. That is below our actual cost.
A new prison inmate rate is accepted, coming with controversy and some bad news for Yellowstone County taxpayers. Plus a double dose of devastation.
People overwhelmingly, if you look at the polls, they support medical aid in dying, and yet the people that are elected think that they know more about what we should be able to do than we do.
A Billings family at the center of Montana's right to die debate as a lawmaker moves forward with a bill.
2, 3, start.
And up and away.
I'll just be sitting in my house, right? I could hear planes flying over, and I'm thinking, what plane is that?
Billings students take to the skies in hopes of one day reaching their aviation dreams. The MTN 10 o'clock news starts right now.
From Montana's news leader, this is the MTN 10 o'clock news.
Good evening and thanks for joining us on this Tuesday night. I'm Russ Riesinger. Our top story, Yellowstone County has approved a new contract for housing federal prisoners. Under the deal, the prison will receive $115 a day per inmate compared to the $117 they'd hoped for. It's an agreement that will end up costing taxpayers more than $70,000. Our David J. dives deeper into the issue and why not all county commissioners wanted it done.
The Yellowstone County Detention Facility houses about 40 to 50 federal inmates per day on average, and the U.S. Marshal Service pays less than what it costs. The county commissioners approved an agreement that decreases some of that deficit.
The Marshal Service has prisoners requiring beds. Yellowstone County can supply those beds. Taxpayers should not subsidize those beds.
Commissioners voted to rescind an agreement for $117 a day that they approved in January and put into place a new rate of $115.
We had to rescind the resolution on the federal government rate so we could implement the new contract.
Commissioners Mike Waters and John Ostlund voted for the $115 rate, which is $2 less than the cost to house an inmate in the Yellowstone County Detention Facility.
The windfall to the county would be over $500,000 to our budget. If you look at the $2 difference, that deficit from what we were asking to what they offered for $2 a day would end up around $70,000 a year.
Waters says the $115 is much better than the $85 negotiated in 2016. And while commissioners would have preferred to have the $117 per day, two of them approved the $115 because the U.S. Marshal Service agreed to that increase just last week.
I was wanting to try to keep that relationship going and also keep a good atmosphere and environment for further negotiations in the future.
Waters says agreeing to the $115 brings in about $500,000 more annually to Yellowstone County. However, Commissioner Mark Morse says the county has been subsidizing the Marshal Service at $32 a day per inmate.
Approximately 9 years we've received the $85 rate, and it's cost us more than that.
Morse says the county's costs are estimated for 2024, and the actual cost may be $120 per inmate. But he says it will stay at the $115 rate for 3 years.
Inflation goes wild, and inflation goes up 10 or 15 or 20%. The only figure we're going to get is $115 a day per inmate.
In Billings, David J., MTN News.
The Justice Department will begin to surge FBI resources to Indian country to investigate unresolved violent crimes. That includes crimes related to missing and murdered indigenous persons. The FBI will send 60 personnel on rotating 90-day temporary duty assignments over a 6-month period. Operation Not Forgotten will be the longest and most intense national deployment of FBI resources to address Indian country crime to date. The FBI teams will use the latest forensic and evidence tools and work in partnership with the Bureau of Indian Affairs and tribal law enforcement agencies. At the beginning of 2025, FBI's Indian Country program had approximately 4,300 open cases, including 900 death investigations and 1,000 cases of child abuse. The Billings Police Department is investigating a death in the Heights. Officers were originally called to a walking path behind Anacapa Lane for the report of a sick or injured person. When arriving on scene, the victim was located, but life-saving measures were unsuccessful. Billings police say they're investigating the incident but did not release any other details. They do say there is no risk to the public. Tonight, another look at the right to die debate in Montana, which currently operates in a gray area in the state. A Northwest Montana lawmaker wants to remove protections to doctors who help patients take their own lives. The argument stems from a Supreme Court case. It's centered around a Billings truck driver. Our Andrea Lutz introduces you to his daughter, who's had to live this tragedy not once, but twice.
You know, he liked to hunt and fish.
Leslie Muchler watched her dad suffer for years.
The treatment wasn't working. He was miserable and just was ready to be done.
The strong family man from Billings was diagnosed with leukemia when he was 76.
He at one point had talked about buying a gun, and he even told my sister that he had done it and he was thinking about killing himself.
He was named as a plaintiff in a monumental state Supreme Court ruling, which allows doctors to use consent as a defense in homicide when giving end-of-life medication to terminally ill patients.
It was approached from a constitutional thing, that we had a right as Montanans in our Constitution to die with dignity, have that relationship with our doctors, and ask for the medication.
Leslie says the day that ruling came down, her dad died, never getting the chance to use the medication himself.
He stayed in it just because he was hoping that somebody else might be able to use it down the road.
Turns out there was. His grandson, TJ.
Supreme Court ruled in 2009, and then in 2015, TJ had his first bout of pancreatitis.
Leslie watched again as cancer took its toll on her firstborn son.
You know, they're not choosing to die, they are dying. They're just choosing how much suffering they want to be put through.
Turns out her father's fight for the right to die would give TJ that choice as he battled stage 4 pancreatic cancer.
He was in hospice. You know, they gave him all kinds of medication. It just didn't control all the symptoms. You know, sometimes the disease is too far gone. And so I feel like I got a lot of extra time with him because he had control of it.
Montana lacks concrete numbers for how many people use medical aid in dying.
There's a lot of misinformation out there about this issue.
It's why Senator Carl Glimm wants to define it.
There's a lot of proponents that will tell people it's legal, but it actually isn't.
He says his bill, which is now before lawmakers, prevents coercion or abuse in end-of-life decisions.
The public policy for the state of Montana needs to be that this shouldn't be a practice. We need to send a clear and consistent message that suicide isn't the way out.
In fact, a lot of
Leslie is again fighting the bill.
I don't feel like the legislature should be able to decide when our suffering is enough.
And agrees the issue should be more defined, hoping to move it from a legal gray area and into the light.
I would really like to see this be put on the ballot and put it before the people of Montana and let them decide if this is what they'd like to be doing.
In Billings, Andrea Lutz, MTN News.
Kind of a hazy look with the Stockman Bank weather cam across the area. We've had some snow showers here in the last little while. 33 and 49 for the daytime high, low and high. We've had top winds up to 35 miles an hour. So far, we've recorded 200ths of an inch of precipitation at the airport. That'll likely get updated regionally. Temperatures today were in the 30s and 40s in most locations. The blue shaded number shows you the average for this time of the year. So a little bit on the cool side as far as precipitation goes. Miles City 0.06 of an inch, but notice most of it's on this line anywhere from Cut Bank down to Sheridan and then off towards the west. And we're going to see more snow in these areas tonight heading into tomorrow. Forecast details coming up.
President Donald Trump is calling tomorrow Liberation Day as the White House is prepared to roll out sweeping new tariffs on countries that tax American-made goods. The president says the tariffs will hit friends and enemies alike, claiming they will raise revenue and incentivize companies to build in America. These reciprocal tariffs are in addition to previously announced tariffs on foreign-made vehicles and auto parts. Those go into effect on Thursday, while a 25% tax on steel, aluminum, and other goods from Canada also awaits. Trump says the Canadian tariffs are in response to the country not doing enough to stop the flow of fentanyl coming into the U.S. Several top economists have warned that these taxes will hurt Americans and possibly drive the U.S. into a recession. The UK, Europe, and other countries all say they'll retaliate with tariffs on American products.
My voice is inadequate. My efforts today are inadequate to stop what they're trying to do.
Democratic Senator Cory Booker of New Jersey has finally ended his marathon speech, holding the Senate floor for a record 25 hours in an act of resistance to President Trump's sweeping actions. Booker called the threats to the American people and American democracy grave and urgent, warning of a looming constitutional crisis. 100 years ago today, Laurel Public Schools shut down for a week after a health epidemic of scarlet fever and the measles broke out. Well, fast forward to now, as a measles outbreak has made a comeback, causing concern around the nation. Our Haley Monaco speaks with a Billings doctor, learning the differences between now and then.
If this were to happen now, it would be our top story, front page headlines. But 100 years ago, it was buried on page 6 in the Laurel Outlook.
In this column with basically gossip.
On April 1st, 1925, Laurel Public Schools closed for the week.
It was like, you know, Mr. and Mrs. Smith went to visit Mr. and Mrs. Jones, and here's what they had for dinner, and the column was this long. And then right in the middle of it was, oh, and by the way, school was canceled because of an outbreak of measles.
We know this now thanks to a popular column in the Laurel Outlook, showcasing what was happening 25, 50, 75, and 100 years ago.
Is done by Stacy, and she has been at the Outlook for over 30 years. She goes through meticulously newspapers.com, and she looks for items that are relevant today.
Fast forward 100 years, and measles are coming back to the spotlight.
Measles is one of the most contagious infectious disease kind of known to mankind.
Infectious disease specialist at Billings Clinic, Dr. Neil Koo, says the measles pathogens linger in the air for an extended period of time. For every one person contagious, many others are at risk.
18 susceptible persons compared to, let's say, COVID-19, even though we just came out of the pandemic, and we're talking about 2 to 3. So it's definitely much more contagious.
As the outbreak spreads in Texas to over 420 cases, it's also spilled over to surrounding states.
It's going to be pockets of Montana where we're probably going to see cases.
In 1925, there was no vaccine for measles, but Dr. Koo says now it's the best way to stay protected. But a recent decrease in vaccinations has changed the landscape.
It's to really getting as many individuals up to date is going to be the best protection.
In 2000, measles was not spreading in the U.S., and new cases only came from abroad travel.
To actually say, I've seen a case of measles, no.
With the hope to not travel back in time.
There's a general epidemic of German measles and scarlet fever.
What happened before the availability of the vaccines, there were a fair bit of hysteria.
In Laurel, Haley Monaco, MTN News.